Venture began in 2010. Someone introduced me to Dr. Stefano Tassin, who is the inventor, the person who developed the therapy and then invented and developed the Gondola medical device. And in a short time, we got to know each other and formed a very strong bond, which has accompanied us up to today. I am an entrepreneur. Before starting the Gondola Medical Technologies Initiative, I was active in other sectors. And since I met Stefano, we have focused our lives around the development of the Gondola medical device. In 2011, we founded the company, and by 2012, we already had the device in its first version, ready for commercialization and certified according to European regulations. We immediately began offering this innovation to patients, and I have to say we received a very interesting response because patients immediately told us that they were experiencing benefits they couldn't get with other therapeutic approaches. So what we quickly realized from Stefano's invention and from the clinical studies we conducted together with doctors specialized in Parkinson's disease was that we had identified a way to improve the lives of patients without having any negative side effects. Afterwards, we continued to invest. We conducted clinical studies, and over the years, we have carried out 14 clinical studies with very important research partners in Switzerland, in Italy, and abroad, even in South America. And we have documented additional aspects each time to highlight that not only did the patients feel better, but there were also improvements, for example, at the brain level with changes induced by our treatment measured with functional magnetic resonance imaging on the patient's brains. This particular activity was carried out at the Campus Biomedico in Rome with the involvement of Professor Carlo Quattrocchi, who is an expert in neuroradiology. Over the years, we have also invested a great deal in product development. From 2020 to 2022, we also received financial support from a European grant, which at the time was called Horizon 2020, and it allowed us to advance our device to the current version, which is now available to patients, and which is characterized by being very easy to use and highly reliable over time in delivering the therapy. Parkinson's disease is an illness for which there is no cure. So there is a great need for therapeutic treatments, meaning treatments that reduce the symptoms of the disease, which is exactly what we do. Over the course, throughout the life of Gondola Medical Technologies, we have made numerous investments because in order to achieve a device that is easy to use and effective, like the one we have today, we had to and wanted to invest heavily in research and development, so in the usability of the device, but also in electronics. Today, we are able to offer patients an app to manage their own device to download onto their own Android smartphone. In addition, we have made significant investments specifically in clinical validation, that is, in funding clinical studies, which have been used to create those scientific publications in international medical journals that document the effectiveness of the therapy delivered by our device. The Gondola medical device today has been recognized as a breakthrough device, meaning an innovative device by the American Regulatory Authority, and we also have CE certification in Europe with the MDR regulation, which is the most recent applicable legislation available at the European level.